morning. My name's Mark. I'm going to be your nurse today. How are you doing, Teresa and Ben?
Hi.
Mrs. Blanco, do you have any questions for me today that I might answer?
Yes, I do actually. We're here to get another prescription for Ben's albuterol inhaler. He's almost out. My very dear friend, a kind of hippie gentleman named Buffalo Rainbow from Taco Time.
Oh, he makes the best tacos, Mom.
He does. Was talking to me about pine bark extract the other day. He mentioned that it might be a more organic form of asthma control.
You want me to eat trees, Mom? I'm not eating trees.
Let's wait and see what the nurse says.
Mom, it's gross.
He says it will alleviate Ben's symptoms without hurting the honeybees or beautiful reindeer.
I know Buffalo Rainbow, and I can only imagine what he'd be saying.
Hey Teresa, it's your friend from Taco Time. Heard Ben's having trouble with his asthma again. She used pine bark extract. It's totally free range, organic, Rainforest Coalition friendly, super good.
Anyway, you must have talked to him just after I saw him last. He tried to tell me about that same thing while I was in the drive-thru the other day. I went for some crispy burritos, and then, well, you know Buffalo.
Yeah, he's a bit of a talker.
Oh, can we go to Taco Time after this? They have red Power Ranger toys.
Yes, sure, we can.
Sweet.
He's so informative and current, though.
I've done actually quite a bit of research into pine bark extract. Let me tell you something about it.
Pine bark extract is sold under the trade name Pycnogenol, a dietary supplement extracted from the Pinus pinasta, or French maritime pine bark. Pycnogenol is used for treating allergies, asthma, ringing in the ears, high blood pressure, muscle soreness, pain, osteoarthritis, diabetes, ADHD, menopausal symptoms, painful menstrual periods, and erectile dysfunction. Pycnogenol is used to slow the aging process, maintain healthy skin, improve athletic endurance, and improve male fertility. Scientific research on pine bark extract has shown some promise, but studies have been fairly small and all have been short-term. There has been no clinical trials published to show evidence of efficacy or identify any possible adverse reactions. The research findings are mixed, and even the positive studies call for further research to be done.
I personally believe that the jury is still out when it comes to pine bark extract. In time, I hope to see some more thorough research into its effectiveness.
I see. But don't you think it could be a good replacement for Benny's albuterol inhaler?
I hate my inhaler. And fine, I'll eat pine bark instead, but I hate my inhaler.
Well, let's discuss what the albuterol is doing before we make any decisions about replacing it with pine bark. I think Ben is using the Acuneb version?
Yes.
Albuterol, also known by its trade name Acudeb, is classified as a bronchodilator used to treat asthma. Albuterol can reduce airway resistance in asthma when inhaled or taken orally by stimulating beta-2 mediated bronchodilation. Inhaled, it is used PRN for rescue or quick relief of acute bronchospasms or in prevention of exercise-induced bronchospasms if taken 15 minutes prior to exercise. Taken orally only on a fixed schedule and should be combined with a glucocorticoid for long-term control in patients with chronic or persistent bronchospasms. Patients should be warned not to exceed recommended dosage since doing so may cause undesired cardiac stimulation and tremors. If oral dosage is excessive, albuterol can stimulate beta-1 receptors, causing angina pectoris and tachydysrhythmias. A life-threatening adverse side effect is paradoxical bronchospasms. Instruct patient to avoid smoking and other respiratory irritants.
So while it's still not a cure for Ben's asthma, albuterol is proven to help when Ben is having an asthma attack and may even help prevent attack if used before exercising or sports.
I see. I guess I don't remember you saying anything about how pine bark extract would help alleviate Benny's symptoms. When he is having an attack, we all get pretty anxious. It's nice to have his inhaler there to help us through them. I guess we were just hoping for a cure.
I understand.
You're gonna have to keep taking the stupid inhaler?
Well, what about it you don't like, Ben?
It's dumb. I don't like using it. The kids call me Wheezy.
What's the hardest part about using it for you, Ben?
Well, sometimes I spray myself in the face. It has a gross taste. It's annoying, and sometimes I get laughed at. I don't like it.
Well, that's a pretty common complaint. Ben, I got bronchitis and I had the same issues. Can you imagine me, a nurse, spraying myself in the face with my own inhaler? So I do have a video for you to watch that will make sure you know how to use it.
Okay, does it have Power Rangers Mega Force?
No, but learning is the greatest power.
Ugh, aren't you tired of fighting that old oxygen tubing? Fed up wrestling that old albuterol inhaler. Well, how about a new inhaler with a spacer? Let's look at this brief. To use your new albuterol inhaler, simply look through the window to see how many puffs you have left. Connect it, window facing backwards, to the inhaler. Remove the safety cap. Attach the inhaler to the spacer via this hole here. It should fit snugly and easily in. Remove the cap, put up to your mouth, and give it a slight squeeze. When you are finished, detach the inhaler from the spacer. The spacer should be set aside for rinsing. Recap your inhaler for later use. Voila!
Okay, so I get how to use the inhaler. We make sure to put it in the right way for starters. Then we hook it up to the spacer and put that up to Ben's mouth and give him a puff.
Oh, that totally squirted in there, Mom.
This should make it a lot easier to get into your lungs, huh, Ben?
Yeah, that's kind of cool. That spacer shoots in there. It will help me breathe better.
So we get how to use it. I guess I'm wondering when is the best time to use it?
Well, you definitely want to use it 15 minutes before any strenuous exercise or sports. Take 2 puffs before you head out. In the event of an asthma attack, you want Ben to take 4 to 8 puffs every 20 minutes or so until the symptoms go away. And it is extremely important that whenever Ben is not having an asthma attack, that he uses inhaler appropriately by only taking 1 to 2 puffs 3 to 4 times a day to prevent an attack.
Okay, so 1 to 2 puffs 3 times a day unless he's about to go and run around outside. Then he takes it 15 minutes before playing. If, and I hope this doesn't happen, he does have an attack, it's okay to give him 4 to 8 puffs every 20 minutes until he feels better.
Exactly. Now Ben, so how many puffs did I say to take before you go play basketball?
I think 2.
Perfect. And how many puffs do you take when you're having an asthma attack?
Close to like 8 or until my mom says not to do it again. But why can't I just keep doing it to make the asthma go away?
Well, that's a good question. If you use too many puffs in one day, it can lead to something called paradoxical bronchospasms. This means that instead of opening up your lungs, when you take a puff, it'll actually close them even more. And this can lead to some serious asthma attacks and even land you into the hospital.
I don't like that at all. That sounds kind of scary, that paramenarch broncho... That thing that he just says, Mom, that sounds pretty scary.
Paradoxical bronchospasms.
Yeah, whatever that is. Can I just call it like a tight chest? That's a little easier. And the only thing good about the hospital is popsicles, but that's not a reason to go.
As long as you know what can happen, that's what's important.
Okay, I got it. And I'm not going to let that happen. That's scary.
Me neither, champ. That's why it's important to use your inhaler correctly.
Okay.
So, do you have any other questions for me that I can answer today?
No, thank you, Mark. I appreciate your help.
Great. Well, be safe. And remember what we talked about. And be sure you call us if...
Well, if I don't feel good and my chest is getting tight, I need to take a puff.
Good job, Ben. I'll see you again soon.
All right, Mom. I totally want to get the Power Ranger toy. And let's go see Mr. Buffalo Rainbow to get some tacos.
Of